All right. Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but also to help you to move on to the brighter side of the health. We make a lot of videos around cerebral palsy, and we know that a lot of our viewers come back to our channel to get more and more information, more insights on cerebral palsy for making sure that their children are able to move on and are having a better quality of life. Right now, when it comes to cerebral palsy, developmental delay, or any issues that a child can face in the initial years of life, epilepsy is one thing that definitely comes in the first list itself. So, epilepsy, unfortunately, is a very common problem, very commonly seen among CP children, and have got a lot of health implications on the life of a child, at the same time, at the life of parents also. And to discuss all of this, we have got with us Dr. Reema Jani, who is a pediatric physiotherapist with HealthQ Rehab. She runs her own center in Surat, in name of Divine Development Center. She is one of the favorite physiotherapists of all the parents whose children are undergoing therapy with us, and she is here to share with us all the insights, all the learnings and understanding that she has accumulated in these years of her clinical practice. So, welcome, Dr. Reema. How are you doing?
I'm good. How are you?
I'm awesome. I'm doing great. Glad
I'm
to meet
really,
you again.
I'm really grateful to you, Dr. Meghna, that you have always provided me with this platform where I can share my knowledge and my experience and even my emotions when I connect with kids and parents.
Right, right. No, this is absolutely an emotional connect, and it is something which is beyond patient-doctor relationship. Children, when it comes to children, they are so pure-hearted that they don't have those filters. They don't have that. Okay, this is my doctor. This is my someone who is outside. Once they build that connection, that bonding, then it's something that lasts forever. So yeah, so would love to have a discussion on all of these things, but I would like to start today's discussion from epilepsy because that's the topic, right? So, what is epilepsy and how it impact a child?
See, uh, if we know what is the impact of epilepsy, then of course we treat it. But of course, as you said, we need to understand what is epilepsy. Now, epilepsy is actually abnormal activity occurring at brain level, and the effects that we see are at motor level. Motor level means the musculoskeletal system of our body, and it may result into abnormal tone of muscle in the body. And this epilepsy impacts the growth of brain as well as the body. See, brain controls entire movement system of the body, right? Now,
Hmm,
when epilepsy occurs, there is a kind of electrical activity, or I would say chemical imbalance. The
hmm,
chemicals which are responsible for excitation, okay, excitatory chemicals, the
hmm,
increases in the brain, and the relaxing chemicals, the
hmm,
chemicals or the neurotransmitters which are responsible for calming down our nervous system, they decrease, and this
hmm,
imbalance results in epilepsy. And clinically, or I would say, uh, on observation, if we notice any episode of seizure or epilepsy, at that time, what we notice is abnormal involuntary muscular contraction in form of twitching of muscles. It could be affecting only even eye muscles at times, not
hmm,
even the entire body. So there are various stages or types of, I will say, types of epilepsy, and even it can occur beyond 10 years of age. See,
hmm,
the risk age is under 10 years.
hmm,
Mostly it is seen up to 10 years, and it's said that beyond 10 years, there are very less chances that epilepsy can come. But
hmm,
recently, I have came across like the kids who have faced epilepsy even beyond 10 years of age. So
hmm,
it does affect beyond a certain age. There were studies previously that it
hmm,
used
hmm,
to affect only up till 10 years of age, but the chances are there that even at later age, see what happens now at early age when epilepsy occurs, it
hmm,
damages the developing brain. Okay, uh, say for example, epilepsy just within few weeks of birth. Okay, the brain
mm,
is in yet a very early stage of development. We call it a
mm,
neonatal stage, right? So
mm,
at that time, the brain is getting affected, and
mm,
epilepsy occurring at later age. Okay,
mm,
so it is affecting a well-developed brain. So in
mm,
both the cases, again, clinically, the
mm,
picture differs. Even the
mm.
prognosis differs a lot.
Right, right. That makes sense. So, what are the causes of this epilepsy? Why a child can develop, or why a child who have got some complication during the birthing process is more at risk of developing epilepsy? Or else you can also say why first year of life is considered the most risky year when it comes to epilepsy attack.
As I said, that the neonatal brain. See, the first thing I would like to address over here is any complications during birthing process will result in a trauma. Any complication, it's a trauma for the child. Our body has certain response to this trauma. Okay, in response to that, our brain may go into excitatory stage.
Mm,
Another thing that can occur is during birthing process, if there is any trauma, there is a
mm,
major chance of hypoxia where the oxygen supply of entire baby, the entire neonate is getting affected. So at that
mm,
time also the oxygen supply of brain will also get affected. If our lungs are not getting enough oxygen, the other organs are not going to get the oxygenated blood.
mm,
So the brain is getting affected at this point of time, and a kind of trauma, as I said, it is a kind of shock for the brain, which is
mm,
manifested as epilepsy.
mm,
Even till 1 year of age, conditions like severe diarrhea resulting into dehydration can also occur, or can also cause this chemical imbalance in the brain.
mm,
See, when there is dehydration, okay, the electrolytes are
mm,
getting disturbed in the body,
mm,
and if these electrolytes are getting disturbed,
mm,
there's a major role of these ions, calcium
mm,
channel, magnesium, then sodium channel is there. So this calcium, sodium, all these ions, if are not balanced,
mm,
then also it will result in epilepsy.
mm,
Another major factor I would say is if a child has jaundice uh, after birth, if they are facing jaundice, then their liver is getting involved over here. And of course,
mm,
there is deficiency of vitamin D, and this can also result into epilepsy. Now,
mm,
this thing connects us towards the metabolic system of the body. So,
mm,
any disturbance occurring in metabolism can also result into epilepsy. So, it could be the cause could be metabolic also. It's not always
mm,
just the oxygen,
mm,
but these are all the possible causes. And yes, as I said earlier, there are different types of epilepsy.
mm,
There's one such type known as reactive or reflexive epilepsy,
mm,
where even bright lights, okay,
mm,
the bright lights or flashes can also trigger
mm.
epilepsy.
Oh.
Of course, you might have come across that the newborns should kept away from flashlights or
Mm,
camera lights.
mm,
So
mm,
there is a possibility that it can also trigger epilepsy.
mm. Right. So I have one question. Like I just came across a lot of, not a lot of, but couple of patients where the history was that the child was starving because the mother's milk was not enough for the child to just fetch the hunger,
Yeah,
and that led to
yeah,
epileptic attack. So any thoughts on that? Any experience that you have got through?
yes, of course, of course. See, what happens post birth, the first thing that the child needs is mother's milk, okay, and
Right.
in many cases, of course, post c-section there's delay in production of mother's milk, because of course mother is kept nil by mouth because of
Mm,
surgery, right? So at that time, if child's hunger is not addressed, or if mother is not lactating enough, or is not having enough supply of milk for the baby, at that
mm,
time, the baby will undergo dehydration. Okay,
mm,
the metabolic requirements are not getting met, and this
mm,
dehydration will
mm,
result in a chain of reactions resulting into epilepsy.
mm.
So, as I said earlier, even in cases of diarrhea, even if a child is suffering with high grade fever,
Fever.
then it is advisable that the child, if under 6 months of age, they should be
Mm,
given frequent feeding by the mother, or If formula milk is given, then frequent feds should be given,
mm,
because in
mm,
fever also the body undergoes dehydration as the body temperature increases.
mm,
And if beyond 6 months of age, if child is having high grade fever at that time, enough
mm,
amount of fluids in form
mm,
of juices, soups, dal, water, that should be given at regular intervals, and the feeds frequency should be increased so the body
right.
doesn't go into dehydration. If there is dehydration, there is increased risk of epilepsy.
Right, absolutely makes sense. So that let's move on to the treatment part of cerebral palsy, or in general. What are the what are the factors that kind of limit the recovery of the child or else development of the child, and especially if you can put more light on epilepsy, like what's the role of epilepsy in the entire progressive therapy, how it hinders the entire process.
Okay. See, as I said earlier, epilepsy can occur at any age, but if a newborn has suffered epilepsy already, the brain has undergone damage, and the condition resulted is cerebral palsy. Now, once there is history of epilepsy, of course, the medications will be started, and medicine plays a role over here to control the episodes of epilepsy. Okay,
Hmm,
but if any disturbance occurs in our metabolic system, okay, if
hmm,
there is any incidences of fever, even this diarrhea, or any sleep disturbances, or any other routine disturbances are occurring, that it can trigger epilepsy.
hmm,
And every episode of epilepsy damages certain part of the every episode. So this is the major hindrance in the progress, because of course
hmm,
parents do start physiotherapy once they
hmm,
know there is cerebral palsy and there's other treatment approaches. They do come to us, give regular therapy. But even a single episode of epilepsy will lead to regression. All the
hmm,
progress that we are achieving, that is getting regressed if there is epilepsy, because every episode, as I said earlier, is going to
hmm,
damage a part of brain which is responsible for
hmm.
certain movement or certain milestone. So child will regress.
Correct.
Okay, that is the major hindrance over here when we are working with physiotherapy, and we want to achieve further milestones. Another thing that can occur as hindrance over here is the epilepsy causing muscular imbalances. See, epilepsy is damaging brain is controlling some or the other area of the body. Now, there are certain areas of brain which are responsible for maintaining our muscle tone. Now, if that area is getting damaged, then it will result into dystonia. And
Hmm,
uh, with dystonia, we have mainly seen that it's very difficult to achieve certain milestones, and even the speech, uh, the
hmm,
mi- uh, not just the gross motor and the fine motor milestone, the
hmm.
odomotor milestone also getting affected and going into regression. So that is the major hindrance, I would say, or major thing that is blocking the progress. So my advice would be like, never skip medicines of epilepsy. Never ever manipulate the dosage of those medicines without the doctor's consultation. As and when the child age is increasing, even in days and months, at that time the body weight changes. Okay, so regular follow up with their consulting doctors is much needed. It should not be skipped. If your doctor
Hmm.
has asked you to come for follow up for after 6 weeks
Right,
or say 4 weeks,
right.
you must go after 4 weeks or 6 weeks, because there is a possibility that there is change in the weight of the body of the
Hmm,
child. You need
hmm,
to adjust the dosage of medicine. And if
hmm,
that dosage is not adjusted and not done timely, it
hmm,
will
hmm.
result in epilepsy.
Right, right, absolutely. So that takes me to the next question, and that is related to the experience that the parents have, the challenges that the parents can face during the child is doing the therapy, and epilepsy comes in the middle, right? So many a times you would have also experienced that this regression happens and there is a pause, and that's where parents usually come up with this question, like if a child has got epileptic attack in middle of the journey of recovery, what is something that we can do in order to maintain certain level of physical mobility of the child, or maybe you
Okay.
can say muscle of the child.
Okay. See, if there is an episode of epilepsy and we are on path of progression, right? So at that time, we go for maintenance. Okay. We don't aim for progression at that moment for that time zone, because the child has faced major physical trauma, of course, the psychological trauma. Even they undergo hospitalization. Certain kids need to undergo a long term hospitalization. At that
Right,
time, also, that the regular physiotherapy is getting affected. But of course, they do get uh, in house or inpatient department physiotherapy treatment in the hospital, where
right.
the stitching part is done, where the positioning are done, where the lung capacities or the overall lung health is also taken care of. So the
Hmm,
proper oxygenation is maintained, and at the
hmm,
same time, calming strategies post discharge.
hmm,
Calming strategies also help a lot, and proper fluid intake. I'm not saying over here just the proper diet intake. Of course,
hmm,
fluids are part of our diet, but
hmm,
more amount of fluids at that time are
hmm.
needed, because
Right.
this has a major role. And as I said, for maintenance, the stretching, certain positioning helps a
Hmm,
lot, and
hmm.
the lung physiotherapy or the chest physiotherapy plays a role in the hospital environment.
Right, absolutely. So, are there any tips that you usually share with the parents to follow when a child has recently got an epileptic attack and is in this process or in this phase of recovery that you would like
Okay.
to share with the audience here?
Okay. The first thing I say is fluids. Okay, the child should not have any chance of dehydration if they have just faced epilepsy or an episode of it. Second thing, the medication. Third thing, proper positioning, which helps in breathing. Say, for example, an inclined position is always better in just flat lying position. Okay,
Hmm,
uh,
hmm,
I would suggest that the child should not be just lying on their back flat on bed. There should be a pillow under the head and neck. It should be an inclined, or we use a wedge, of course. So it
right.
assists in breathing also. It's a
Hmm,
better position at that time.
hmm,
Second
hmm,
thing is, at that moment, we don't go for rigorous exercises, of course,
hmm,
no
hmm,
rigorous physiotherapy, but
hmm,
the stretching part can be done if child is given splints. Then the
hmm,
splints can be continued at that time. Just
hmm,
make sure it should not hamper their breathing.
hmm,
That needs to be taken care of. And if child is not suffering with any other condition along with
hmm,
epilepsy, then they must go with stretching and positioning. If there is any underlying conditions, like in many cases, we see it's not just epilepsy, they do have other conditions going on. They have severe fever, high grade fever is also there. At that
hmm.
time, management of underlying conditions and other conditions is also mandatory.
Right, right, right. That absolutely makes sense. One thing I would like to add up here from my understanding and my reading, which could help a lot of people. So there's a very famous neuroscientist. His name is Andrew Huberman, whose podcasts are very famous, and he recently mentioned about the importance of red glasses. So, what are the white lights that we get exposed to on a regular basis have a lot of impact on exciting your brain centers,
Yes,
right?
yes.
So when the screen time for children is more, or else let's say in the night time, like the way we are sitting right now under tube lights, right? So these white lights are exciting, so they excite the brain centers. But if you are wearing a glass or else a red eyewear, what it does is it filters out those blue lights and gives a lot of calming effect. So ideally also for children, exposing them to white light is not good because it constantly stimulates a brain. Now just imagine a epileptic brain which has got a lot
Okay.
more excitation, right? Now if we have to calm it down, then we have to work on lightings. So lightings also play a very crucial role, and if we cannot change the lighting environment, at least we can add some layer of glass, maybe not for a very small baby, but for a child who is maybe 3 years old, 4 years old, 5 years old, wearing those glass after sunset makes
Yes,
sure that the neurotransmitters are not getting hyper excited, the brain centers are not getting hyper excited, and that kind of reduces it. So
yes,
yeah,
very
that was
true.
one.
As I said, reflexive epilepsy,
Yeah,
like occurring in response to bright lights and
correct,
flashlights. Even
correct.
sometimes a child is suffering epileptic attack,
Yeah.
and you can notice it if there's just blank staring at
Right.
a light or the light bulb, even at a distance, even at the dark room and outside the window, if there is a bright white light and
Right.
child staring at it, can have it.
Right.
Even the moving things also excites the brain. One
Hmm.
reason, the moving fan, looking constantly at moving fan will
Hmm.
increase this excitation process. Okay, so
Hmm.
those neurotransmitters will increase and the calming ones will decrease.
Hmm.
And the production of these excitatory chemicals will lead to epilepsy. And that's the reason the screen time. See, when a child is watching a screen, is always moving. They don't watch just photographs on the screen, right? They watch
Right.
videos nowadays. They're
Correct.
constantly moving under very bright lights and sound, which is, of course, at a certain pitch, which is not just the calming or the soothing one. So
Hmm.
that also excites the entire. It's like bombarding our sensory system
Hmm.
and excitability. We are
Right.
increasing arousal level. If
Right.
arousal level is increasing, it is creating the environment that epilepsy can.
Correct. Correct. So, yeah, absolutely. So, if parents can take care of these small things, also incorporating very light music, incorporating food that calms the system or not excite the children. Like, for example, sugar is something which kind of excites the body a lot, right? And the children are exposed to sugar so much that it kind of excites their entire system and can lead to epileptic attacks. So, if these kind of small changes, if parents are able to incorporate, um, absolutely we cannot cure epilepsy, absolutely we cannot stop epileptic attack, right? But at least we can prevent to an extent the severity of epilepsy attack and also the frequency at which these epileptic attacks are coming, right? So now let's move on to the next part or next phase, and that is about the cerebral palsy management itself, right? So cerebral palsy, as we all know, is an damage that has happened to the brain before birth, during birth, or after birth, which will lead some after effects in the body in the form of quadriplegia, spastic diplegia, or whatever it is, right? And the children or is the child is the most important thing that they face is the physical development, right? Now when it comes to physical development, parents are concerned and confused what they should focus more on, and then they end up doing a lot of exercises, so many that they end up getting nothing out of it. So what is your approach, or how should they go about it?
See, what I feel, see, when we started, now I mentioned like I'm very grateful that I can even share my emotional journey. So,
Right.
from parents' perspective, I always feel that they are in search of a magical wand that
Right.
can instantly give some result. Okay,
Correct.
and the exercises, they always think that the more exercises, the better it is. But
Hmm.
it is not the thing. The child, if getting exhausted, can also hamper their entire system. So it's not just the number or the frequency of the exercises in a day or at a given set of time. Of course,
Right.
it should be done regularly. It should be done daily. Sometimes it's like so many exercises in a day, then 3 4 days there is a long break because of some or the other reason, and again the exercises are done. But if we
Correct.
notice our exercise physiology, okay,
Hmm.
most of the time, even when we adults go for exercises, it is saying that 5 days in a week,
Hmm. Hmm.
continuous do the exercises, take
Correct.
2 days of break, that is 48
Correct.
hours, okay,
Hmm.
and then go ahead, okay. It should not be because it puts strain on our
Hmm.
cardiovascular system, on our
Right.
pulmonary system. As you
Right.
mentioned about the sugars, see, sugar also lead to dehydration, leading to epilepsy.
Right.
Vigorous exercises leading to dehydration can also trigger epilepsy. So, of
Correct.
course, exercises are important, but
Hmm.
the dosage of exercise varies from child to child depending on their age, depending on their physical capacity,
Hmm.
depending on the type of cerebral palsy that they have. Of
Correct.
course, a child having uh, spasticity, okay, will have a different set protocol and dystonia. So there are two different things. The
Hmm.
exercise set, the way they will cope up, and even their inner motivation also differs. Every child has that inner drive. The
Correct.
inner motivation plays a role over here. Of course,
Right.
certain exercises, the passive part can be done daily. That is the stretching, the
Hmm.
positioning, the relaxation techniques that can be done daily. But
Right.
the exercises which needs effort from the child, okay, that needs to be divided in such
Correct.
a way that it is not putting so much strain on the child.
Yeah.
And always remember, if your child is having fever, no exercise
Yeah.
because body
Absolutely.
is already dehydrated in fever.
Dehydrated. Correct, correct. Makes sense. So I think there is a very much high need of structuring this exercise program, because randomly when they are doing it, they just feel that okay, stretching is done and it's done, and sometimes they end up doing a lot. So there has to be a balance. There has to be a midway, which basically thinks child at the center, keeps child at the core, and see what are his capability or her capability, and then decides, because every child is different. Parents don't understand that, and they start comparing that, okay, that child is able to do it, why not this child able to do it? So if we can set certain clear grounds for them, that see, your child is different, and this are his capabilities, this is where the
Yes,
limitation is there, and we structure an exercise program that revolves around those child's ability, then we can
yes,
expect good outcomes, right?
very
Yeah.
true, very true. Even
So
even sometimes uh, if we go according to psychology, na, like the more the better, but it's not true over here. It's
correct.
not more the better. I would say it should be
Yes.
optimum dosage of exercise. Just like medicine, if we don't give, na, the more, if I
Yeah.
give full bottle of medicine today, it will be cured. No, we go
Yeah.
with the optimum dosage with medicine.
Mm,
So with physiotherapy also, optimum dosage of exercises are needed, which needs to be customized, varying
mm,
from child to child. As I said,
right.
the stretching or the passive part, okay, parents can give it. But in that also, as you mentioned, the stretching should not be like going on with stretching a lot of stuff, because that is also going to put a lot of strain on the child, because stretching is always painful and
Correct.
pain is a trauma.
Correct. Right. Right. So tell me one thing. What's your thoughts on online physiotherapy for children? How effective it is, and what are their limitations as well?
See, when we say online physiotherapy, before the decade, there was nothing like this, and there were challenges where people living in certain areas not having access to proper physiotherapy, especially over
Mm,
here talking about pediatric physiotherapy. Okay, lack of that thing was there, like they didn't have proper access. The parents, of course.
correct.
Now with
Correct.
online physiotherapy, from any corner of the world, I would say they
Mm,
have access to physiotherapy to learn it for their child. Of course, it's not
correct.
like learning physiotherapy for each and every child. We cannot teach it on an online platform. But
Absolutely.
pertaining to the child, of course, we can guide the parent to do
Mm,
certain exercises. And of
mm,
course, gradually, it's not like we can give it all together at a time. It
mm,
has to be divided. It has to
mm,
be done with regular follow-ups. It's not like today I have taken consultation and it's done.
mm,
The parent expectation should not be such that today at 6 months of age of my child I am taking physiotherapy session, one online
mm,
consultation,
mm,
and it will be fine for next 3 4 months to go on with the same thing. No, regular follow-up, how the child is reacting to those exercises, what is
mm.
the progress, are there any requirement to decrease any exercise or to add on any exercise. So regular follow-up needs to be done. But one thing is that the convenience over here in online platform, at
Hmm.
any time and from any place, you can have access to this
Hmm.
physiotherapy guidance for your child. That is the best part of online physiotherapy. It doesn't bind you to any place or any time. That's the superb thing. It's not like I'm staying in one particular area and I have to search for the physiotherapist in that area. No, you can have access to a physiotherapist living miles and miles away and can have that expert guidance. Second thing, you can have a continuous support via online platforms like a lot of things like the WhatsApp, say for example, a very handy thing where you can just on tip of your thumb, like you are asking certain doubts. If today you are doing some exercise, you have a doubt, you have a question, you can reach out to them. That's the
Correct.
best part. And as I said, the limitation part over here is the follow up part.
Hmm.
A lot of parents give up in between.
Hmm.
It's a long journey. It's a long journey. It takes years and years to get that result. Not that
Right.
we are not getting results. We do get it. But the consistency, they need to stay connected for longer duration
Hmm.
to share. Even I always recommend like share day-to-day exercise blogs. When I provide online physiotherapy, I wish that parents should be like, okay, today we did this exercises, ma'am. It went
Hmm.
fine. Okay, just let us know.
Correct.
Next day, okay, we did this, but one this exercise was a bit difficult. Are there any ways that it can be altered or can be done in any other way?
Hmm.
I would be glad if someone is asking me what happens to the biggest limitation when they have a next scheduled session. At that
Okay.
time, they come up with the doubts.
Hmm.
Okay, we did this exercise, but it was a challenge. Of course, you can ask in between. And in next session also, you can of course ask at that time also. But if you ask earlier, it's
Right.
better. There is a
Right.
good opportunity on online platform that you can ask at any time. Of course, we do
Yeah.
take some time in
Responding.
replying or
Correct.
connecting. But if they are asking, we do connect with them. I especially do connect
Absolutely.
with them. Yes.
Absolutely. Absolutely. Yeah. That's so insightful and helpful. And I guess that's where the community roles can come into the picture. Like how we are trying to do is we have created some Telegram groups and we try to kind of share
Yes.
ideas and share information and see that what they respond. But yes, there is a bit of extra effort from parents also required. So it's like a collaborative thing. It's childcare is collaboration. It's not just the role of physio, not just the role of parents. It's something where parents and physio have to come together for the benefit of the child, and doing something which is combining. So it's all about, even online, we don't say that you take online, right? That's not the point. The point is that the child should get help. He should not get missed out. Like imagine in COVID time what happened.
Yeah.
Suddenly the child was therapyless for months, right? And if the online platforms like it would not have been there, they would not have got the therapy that they could get it, right? So using any medium, whether it is someone coming to your home or you going to someone's house, like someone's center, or taking online physiotherapy, the idea is one thing, that the consistency for the child's development or child therapy should not break. And that's why we believe that having multiple options to the parent and using combination of all of them will be a way ahead to make sure that the child gets that constant progression that he or she deserves, right? So yeah, that was our insights about epilepsy and cerebral palsy. Thank you so much, Dr. Rima, for sharing your thoughts and your insight. As always, it is very much fun, it's always insightful, and it's very candid to have discussion with you. So thank you so much. We'll have you again with some other topics, and we'll have more discussion around it.
My pleasure, totally my pleasure, dear. I'm grateful to this platform, which helps me to connect with a lot of parents whom even I've not met personally, but we have
Right.
built a bond more than like the
Correct.
personal touch that we have
Right.
now. Like we have not
Right.
met, but it feels like okay, I know that person and I know the child and the child's progression. The moment they share the videos, the
Videos.
child performing activities in the videos and they share the progress. It's so much
Correct.
delightful. I get a very nice sleep, when I see those shared videos from the parents. It's the
Yeah.
best thing. And
Yeah.
seeing and being the part of their journey. It's not just seeing, but being part of their journey.
Absolutely. Right, right.
Yeah.
Absolutely, absolutely. So it's a pleasure to have you as well on the platform because all parents love you a lot, and that we have seen on a consistent basis. So looking forward to have more collaborations, have more children getting therapy through this initiative, uh, and looking for more further programs. You know how we make this entire thing better for all children out there. Right. All right. So thank you so much, guys. Thank you for watching this video and make sure to subscribe to our channel. And if you want to consult Dr. Reema Jani, all you need to do is just log on to www.healthqrehab.com. Her profile is there live. You can just book direct appointment with her and she would be there to help you out further. On that note, we'll end this video here. Bye bye.
Bye bye.